Dr. Chan. Obviously, the findings published in The Lancet last week showing, particularly, I think it was in the study trial period was from late March to mid-April, right? So we're really talking about the height of what we're considering to be the first wave still in the US and UK, survey results showing that clinicians who are reporting, I guess, worse PPE reuse, PPE, and exposure directly to patients were obviously the risk of infection was, it seemed almost exponential, right? Can you talk us a little bit about the findings and what exactly your key takeaways were?
Sure. I think we all appreciate that healthcare workers on the front line of COVID-19 are really facing enormous risks when it comes to their personal risk of infection. And we've been learning about healthcare workers all across the US and also the UK and their experiences, and we know that healthcare workers are getting sicker at higher rates. However, it hasn't really been clear to what extent their risk is higher and sort of what the magnitude of that risk is. And we also don't really know what sort of things healthcare workers can do to mitigate their risk and how important it is for healthcare workers to have sufficient protective personal equipment. So we embarked on this study, which used a mobile phone app called the COVID Symptom Study to really survey a large number of individuals across the UK and the US about their experience with COVID-19, especially during that sort of peak of the pandemic in both countries. And we also specifically queried healthcare workers at the time so that we could compare between the two populations the risk of COVID-19 and also understand more about what healthcare workers were facing. And so this provided us a very unique opportunity to really do a comparative look at risk and also to understand what are risk factors for developing infection. And we found that healthcare workers had at least a fourfold higher risk of getting infected with COVID-19 compared to those in their general community. So providing, I think, a number on that risk, which I think had not previously been well known, and also providing for the first time a glimpse into what type of risk factors healthcare workers were facing. It was clear that healthcare workers that were working on the front line and had reported inadequate amounts of PPE or inadequate access to PPE had a substantially higher risk of infection, especially if they were coming into contact with patients that were either suspected or documented to have COVID-19. So there was about a six-fold higher risk in those types of healthcare workers, and it was important to document that because I think we all, I think in principle, know how important PPE is, but again, this put a number on the risk. In addition, we were surprised, or maybe not so surprised, but really, I think, disheartened to see that the difference in risk also seemed to be based on other factors. In particular, we found that Black, Asian, and minority ethnic healthcare workers, including Hispanic healthcare workers, had almost a twofold higher risk of infection compared to white healthcare workers. So even though all healthcare workers were at higher risk, it was those that came from minority backgrounds that really had the most substantially elevated risk. And in addition, they were the healthcare workers that reported the most inadequate amounts of PPE. So I think it does highlight that the PPE crisis in our country is really not equally felt, and that there are disparities in PPE access that I think hint at or highlight really the fact that there are structural inequities in our system. And I think we need to be conscious of those as we sort of think forward about how to address this problem for healthcare workers, especially those from minority backgrounds.